and welcome back to another episode of the Smart Start Recreational Therapy Insights YouTube series by Smart CU's Hub. I'm your host, Nathan Lamaster, the founder of Smart CU's Hub. And folks, we are on to episode number 50 today. So we are just 2 episodes after today. We will be done with our 52 episode goal for the year. And guys, if you've been liking these videos and you find them helpful, even just a little bit, please help us out by hitting that like button and that subscribe button and that notification bell so you get reminded of this content as it comes out every single week. We're still discussing whether or not to continue this after this series is up or changing it up, the format or how we're doing it, because, we've done it the same way for 1 year. And, this could be a portion of content, and then we can dive even further or expand into our new relationship we have with the health, physical education, recreation, and dance professionals, which, now Smart CU's Hub is serving as well. So we might even have a series for them. Love for more guests to come on the show. So if you've ever been interested in getting something out there about recreational therapy, discussing the field or a topic that you're passionate about, I would love to, maybe have you on, do a Zoom together, and we could record this interview style. Well, guys, we're going to talk about today a topic that is not very sexy. It isn't at all, honestly, but it is something that is important, and it's something that we don't always talk about. Okay, so we're talking about workplace safety and risk management in recreational therapy. I know I'm going to try to make this informational, quick, to the point, and guys, we're just going to kind of figure this out together as we go. All right, so why does safety matter in recreational therapy? Okay, so whether you've been working in a hospital, a long-term care facility, a behavioral health unit, community center, you name it, all there is recreational therapists work. Safety is a non-negotiable, okay? It's very important to keep our clients safe, that we do not cause more harm to them, if we are helping them, okay? So our clients often have complex medical conditions going on, some behavioral or medical needs that accompany them when we're working with them, which means risks must be identified and discussed and mitigated from the moment they walk in to be with us. Okay, heaven forbid, we see on the news recreational therapist causes some sort of harm, and that hurts our whole field. So we need to make sure this is a priority. Just wanting to set that up. All right, now let's talk about some common hazards that you might run into in recreational therapy settings. So some of the most common issues for RTs include risk for falls. Okay, you work with senior adults or people that have mobility issues, and falling could be very detrimental. It could break a bone. A lot of times people are a little frail, and when they fall, it could even kill them. So very important that we mitigate fall risk. Okay, equipment malfunctions. So sometimes the intended way our equipment is supposed to work doesn't always work that way. So you should always do periodic looks through your inventory, equipment that you're using, and see if there's any potential things that could cause problems or if they need to be repaired or replaced. Okay. You could also be looking at allergic reactions. So sometimes there's, you're having a food event and using food as part of the social event. And somebody might have a diet issue where if you gave them certain thing, that could cause them to go in anaphylactic shock, right? You want to be aware of any dietary restrictions or allergic reactions, obese things, a client, and then you got to know what to do if that happens. Okay. All right. Sometimes you have to deal with aggressive behavior and how to mitigate that. So obviously that's redirecting, that's giving choices to the person, making sure they don't hurt themselves or hurt someone else. And you also need to be able to keep yourself safe. Okay, so one plan that I like that I learned when I was working in behavioral health was called SAMA. So if you want to look into it, Sama's program to talk about de-escalation, how to protect yourself while also protecting the other person, be able to handle the situation as safely as possible while you're not causing harm to the person who's being aggressive towards you, which is kind of difficult sometimes. All right, how to build a risk management plan. Okay, an effective risk management plan doesn't have to be complicated, but it should include regular safety audits where you do of your equipment, of your environment that you're bringing clients to, documentation of incidents or near misses, just to make sure that those things are documented. So if they were ever brought up in court, you could actually go back to this documentation showing how you handled it and what you did to keep it safe, and if there was an injury, what you did to um, uh, fix that problem so that it never happened again. Okay, emergency procedures and training. Okay, should be in your plan, and activity specific risk assessment. So if there's certain activities that you do pretty often with clients, and being aware of what the risks potentially are and what you could do in case of scenario A, scenario B, and how you're going to handle them, just so you know what to do in case of an emergency. Now, talking about collaborating with teams and clients, okay, safety isn't just a solo act, right? We work in interdisciplinary teams, including nurses, maintenance staff, and administration to report issues to. So if I had something that was going to potentially cause a slip and a fall, in a hallway because maybe there's water on the floor, right? And you have somebody who's there doing maintenance or housekeeping, and they can come clean the floor to make sure the client doesn't slip. That's something you should be doing. You should be addressing the problems as they come up, addressing them with the appropriate person. You don't want to forget the client and the caregiver education component either. Okay, setting boundaries and expectations reduces the likelihood of injuries or emergencies. So now we're going to talk about some legal and ethical considerations. Not managing risk appropriately could lead to ethical breaches or even lawsuits, right? If you did not address something, it was negligence or malpractice or neglect. Any of those things are very serious, right? Clear documentation is your friend here, right? You want to make sure you can identify what led up to the incident, how you handle the incident, and what the results were after the incident, and what are you going to change in the future if something needed to be changed, or what are you doing to help the client continue to get better after they got hurt in your care. You want to make sure that you are following protocols, policies of your place of employment, right? And because that could also be a lawsuit for them. And doing ongoing training with the staff about safety. So maybe once a year, just a reminder. Obviously, whenever someone is hired, doing that as part of their orientation is a great idea. But they can go a long way with protecting your certification. It could protect bad press about recreational therapy, right? You name it. So to wrap things up today, workplace safety and risk management are exciting buzzwords. They're not sexy, right? But they're very important. They could be the difference of you getting sued and losing your license, and it could be a client getting injured and you really did not want to injure them and they're permanently injured, or it could even result in death sometimes when you don't catch a fall. Okay, so proactive risk assessments need to be done for both clients and staff. Okay, collaborate across departments to catch safety gaps. So housekeeping with administration, any of that stuff. Dietary. Okay, educate clients and staff alike on safe participation. Make sure people know what to not do beforehand so they don't do that thing. You warn them, right? and then maintain documentation that you could use to, if you ever got brought in for a lawsuit or something needed to be investigated, you would have that documentation there of what happened. Okay. So next week, guys, we're on episode number 51. And that means we're just one episode away from finishing off the year. And episode 52 is going to be basically a reminder of what year at a glance, like all the different things that have happened for Smart CU's Hub in the field of recreational therapy through this YouTube series, all that stuff. But next week for episode number 51, let's not get too excited. Okay, we're going to start with episode 51. We're going to talk about continuing education and lifelong learning in recreational therapy. So you better believe there's going to be a plug for Smart CU's Hub. Just kidding. All right, guys. Without further ado, and I have loved doing this for you each every week. If you are interested in coming on, please leave a comment. Please show us some love. Hit that like button. Hit that subscribe button. And then, next week at 7 a.m., we'll be talking again. So, guys, I hope you have a great start to your week. And as always, recreational therapists,